Okay, so you're prepping for a speech pathologist interview, huh?
Lots of people getting ready for those.
Yeah, and you want to walk in feeling super confident.
Like you own the place.
Exactly. Well, stick with us on this deep dive,
We're
folks.
going to give you the inside scoop.
We found this awesome guide on Indeed.com all about common speech pathologist interview questions.
Oh, Indeed's a great resource for this kind of thing.
It really is.
Yeah.
So get ready to go beyond just answering the questions. We're going to help you impress those interviewers.
Blow them away.
Exactly.
It's interesting what this guide points out, actually.
Okay, what's that?
It goes beyond just like, you know, knowing your stuff about speech pathology.
Right.
It's about those other little things.
The subtle things that make someone stand out.
Yeah, exactly.
Yeah. So like what?
Like it says, interviewers look for exceptional interpersonal skills,
Oh, okay.
which, I mean, that seems pretty obvious for any job.
Sure.
But why are they so important for speech pathologists especially? I'm curious about that.
I mean, you're working with people who are already struggling, right?
That's part of it, yeah.
I mean, patients, families, even other healthcare professionals sometimes, right?
Right, you got to be able to connect with all of them.
Totally. So maybe it's not just about being friendly, it's about being able to,
Adapt.
yes,
Yeah?
adapt your communication style, like you're speaking a whole bunch of different languages.
Ooh, I like that. Like the language of empathy.
Yes, and collaboration.
Oh, and clear explanations, too.
Right. Not too technical.
Exactly. I had a patient once, little guy, completely nonverbal.
Oh, wow. How do you even begin to...
You have to read their body language,
Okay.
like a detective almost.
Really?
You become a detective trying to decipher their way of communicating.
And create a space where they feel safe to communicate however they can.
Absolutely. And speaking of things interviewers look for,
Okay.
it's not just skills, it's also, well, they call it genuine passion.
Oh, okay. I feel like that's something I always struggle with,
How do you convey that in an interview?
Yeah, without sounding cheesy or like you're reading a script.
Right. I think it boils down to telling your story.
Okay.
Think about what made you choose this path. Why speech pathology? What experiences solidified that choice?
So like if you had a family member who struggled to communicate.
Exactly. Or maybe you saw how speech therapy helped someone, made a difference.
Right. Share those stories from the heart.
And the passion just comes through naturally.
You don't have to say like, I'm passionate about helping people. It's more like you're showing it.
Yeah, exactly. Like if they ask you that classic question, you know the one? How have you handled a difficult patient?
Oh, okay. Yeah, that's a tough one.
It is, because they're not just testing your problem-solving skills, they're also looking at your empathy.
Can you give an example?
Well, the Indeed guide actually has a sample answer that's really good. It starts by acknowledging the child's frustration.
Like their behavior is communication in itself.
Exactly. Then it talks about building rapport before even starting therapy.
That makes sense.
You can't expect a child to cooperate if they don't feel understood.
Totally. Like safe and understood.
Exactly. Then it talks about using creative, fun activities to engage the child in therapy.
Ooh, I love that. So what would that actually look like, though?
Okay, let's say you're working with a child who stutters. And let's say this child loves superheroes.
Okay, so instead of just drills and stuff.
Right, you could incorporate their interests. Maybe they practice ordering food at a pretend restaurant with Batman. Or they create a comic strip where Superman has to overcome a communication challenge.
Oh, that's awesome.
You're making therapy fun and engaging.
Exactly. And that's where the passion comes in. When you genuinely want to help each kid succeed, you come up with those creative solutions.
Exactly.
So, moving on, there's another question in this guide.
Let's hear it.
It's about explaining a complex concept to someone who's not a speech pathologist.
Oh, that's a good one.
It feels like a really important skill.
It is, because you'll be doing it
Enough
constantly.
time.
Yeah. To patients, families, other doctors.
You're like a translator almost.
Yeah, bridging the gap between that technical world of speech pathology.
And the everyday world of your patients.
The Indeed guide suggests using simple language and relatable examples. Like, if you're explaining how the vocal cords work, you could compare them to the strings on a guitar.
Okay, I get it.
Different tension makes different sounds.
Just like how we adjust our vocal cords.
Exactly. So simple, but it makes it click.
I love that. Finding those everyday connections to explain complex things.
It's a skill that makes a good speech pathologist great.
Okay, this next question kind of stood out to me. What is the most challenging aspect of being a speech pathologist?
Ooh, yeah, that's a tough one.
How do you answer that honestly without,
Scaring them off.
yeah, without making it sound like you're going to burn out in a week?
You have to be honest. but you frame it in a way that shows you're like a problem solver.
I see.
The example answer talks about the difficulty of creating personalized therapy plans, which is so important. But then it connects it to the reward of seeing those plans work.
Acknowledging the challenge, but focusing on the positive impact.
Exactly. It shows you, get it, that every patient is unique.
It's not one size fits all.
Exactly. And that's what makes speech pathology both challenging and rewarding.
So true.
So we've talked about interpersonal skills, passion, handling tough cases.
Some big stuff.
But there's so much more in this guide. You ready to dive into some more questions?
I'm ready. Hit me with them.
All right, let's uncover some more secrets to interview success.
Yes, let's do it. All right, so we're back, ready to dig into more of these interview questions.
I'm excited to hear what you picked out.
One that stuck with me from the last part was the question about working with culturally diverse populations,
Oh, that's a big one.
especially these days.
It's so important,
Yeah.
as speech pathologists, we have to be aware of all those different backgrounds.
Cultural and linguistic, right.
Exactly. It's not just about being polite. It's about making sure everyone has access to the same quality of care.
So, practically speaking, what would that look like?
Well, let's say you're working with a child who speaks English as a second language.
Okay.
You have to figure out, are their speech difficulties actually developmental?
Or are they just learning the language?
Right. You don't want to misdiagnose someone just because they're from a different culture.
That makes sense.
So you might need special assessment tools.
Or even consult with another speech pathologist.
Exactly. Someone who specializes in bilingualism, maybe.
Right.
And it's not just about the assessment either.
What else?
You have to consider the family's beliefs and practices around communication,
Oh, interesting.
Like in some cultures, direct eye contact can be disrespectful.
Really?
Yeah. So you have to be mindful of that when you're interacting with the child and their family,
It's like you're learning a whole new culture.
along with a new language. Exactly.
And we have to be aware of our own biases, too, right?
That's a huge one.
It's easy to fall into those traps.
We all have unconscious biases.
Absolutely. Can you give me an example, maybe, of how that might show up?
Sure. Imagine you're working with a child from a low-income family.
Okay.
You might make assumptions, even unconsciously, about their access to resources or their education level.
Right.
And those assumptions can influence how you approach therapy or even just how you talk to the family.
It's like those biases are a filter we see the world through.
That's a good way to put it.
Yeah.
And we have to constantly check that filter, make sure it's not distorting things.
We have to challenge ourselves.
Absolutely. Seek out training, be open to learning from the families.
They're the experts on their own culture.
Exactly. It's not just treating a disorder, it's working with a whole person within their cultural context.
So well said. Okay, another question that stood out to me was about taking care of your own mental health.
Oh, that's crucial.
So important, especially in a field like this.
Speech pathology can be so rewarding, but it's also emotionally draining.
You're dealing with people's struggles all the time.
Exactly. So you need strategies for managing stress, preventing burnout.
What are some practical things you can do?
Setting boundaries is
Yeah.
huge.
Like between work and personal life.
Yes. Setting limits on your availability, making sure you take breaks.
Protect your energy.
Exactly. You can't pour from an empty cup.
I love that.
Finding a supportive community is also important.
Like other speech pathologists.
Yeah. Sharing experiences, offering advice, just having someone to vent to.
It's a reminder that you're not alone.
Exactly. And it's a great way to stay up to date, too.
Oh, right. On new research and best practices.
Exactly. And let's not forget self-care.
Taking time for yourself.
Do things you enjoy, whether it's reading, hiking, whatever.
Spending time with people you love.
Exactly.
Yeah.
Taking care of yourself lets you be your best for your patients.
It's not selfish, it's essential.
Okay, one more question I want to tackle.
Hit me.
It's about navigating those tricky workplace dynamics. Like how would you handle a disagreement with a colleague?
Ooh, yeah, conflict resolution.
Disagreements are going to happen. It's about how you deal with them.
I see.
The Indeed guide talks about active listening.
Really trying to understand the other person's perspective.
Ask clarifying questions, summarize their points.
Make sure you're on the same page.
Exactly. It's about finding common ground, even if you don't agree on everything.
And if you can't, maybe involve a supervisor or someone neutral.
To mediate, yeah.
So it's not about winning the argument.
It's about finding a solution that works for everyone, especially the patients.
Reminds me of that saying, it's not about being right, it's about doing what's right.
Exactly. We're all on the same team, working towards the same goal.
Providing the best care for our patients.
Well said.
Okay, so we covered some heavy stuff today.
We did.
Cultural diversity, self-care, conflict resolution.
Lots of important topics.
I feel like I'm even more prepared for those interviews now.
That's great to hear.
Thank you.
You're going to do great.
I hope so.
Remember, confidence is key.
Easier said than done sometimes.
I know, but you've got this. You have the knowledge, the skills, the passion.
What more could you ask for?
Exactly. Go out there and rock those interviews.
All right, I'm going to try. Okay, we're back. Part 3 of our deep dive. I'm ready for those curveball questions you mentioned. You know, the ones that really make you think.
Oh, you mean the ones that separate the good from the great?
Exactly. The ones that show you really know your stuff. Speaking of which, there's one in this Indeed guide.
What is it?
How familiar are you with AAC devices?
Oh, that's a good one.
I know AAC stands for Augmentative and Alternative Communication, but...
It's a huge field and growing all the time.
Yeah, so why is this such a good question to ask in an interview?
Because it shows the interviewer that you're up to date on the latest developments in the field.
Okay, that makes sense.
AAC is all about giving a voice to those who might not have one.
I mean, literally, in some cases.
Exactly. And it's not just about knowing how to use a specific device. It's about understanding the whole range of options.
There are so many, aren't there?
From low-tech things like picture cards to high-tech stuff like speech-generating devices and eye-tracking software.
You have to know which tool is right for each individual patient.
It's like being a matchmaker, pairing people with the tech that best meets their needs.
I love that analogy.
You're not just treating a disorder, you're empowering people to communicate.
So powerful. Okay, another question that caught my eye was about professional development.
Staying up to date is so important.
In any field, but especially one that's always evolving.
Exactly. New research is coming out all the time, new therapies, new technology.
So how do you show that you're on top of it all?
Be specific. Talk about journals you read, conferences you've attended.
Workshops, training courses.
Exactly. Mention any professional organizations you're part of.
It's about showing you're committed to lifelong learning, right?
Absolutely. You're not just coasting along, you're always seeking out new knowledge.
Always striving to be better.
Which leads nicely into another question from the guide. It's all about letting your passion shine through.
Oh, I think I know which one you mean. Something like, what do you find most rewarding about being a speech pathologist?
That's the one. It's your chance to talk about those moments that make it all worthwhile.
Those breakthroughs, those connections.
When a patient says their first word or communicates something for the first time.
It's about witnessing those transformations.
Exactly. Helping someone find their voice, connect with the world.
It's incredibly rewarding.
And those stories, those moments of connection, that's what you want to share in an interview.
Let your passion shine through. Okay, I have one last question.
Go for it.
It's about time management. Something like, tell me about a time when you effectively managed your time.
Oh, time management. The bane of every speech pathologist's existence.
It's a juggling act for sure.
So many patients, so many deadlines, so much paperwork.
So how do you show that you can handle it all?
Give specific examples.
Yeah.
Did you implement a new scheduling system?
Or streamline your paperwork process?
Maybe you found a way to be more efficient with your therapy sessions.
It's about working smarter, not harder.
And ultimately, it's about freeing up more time to focus on your patients.
Well, I think that about covers it for this deep dive into speech pathology interview questions.
We've covered a lot of ground.
We have. From those core qualities interviewers look for,
Interpersonal skills, passion, problem solving.
to those curveball questions that really make you think.
Cultural diversity, professional development, time management.
I'm feeling so much more confident now.
That's what we like to hear. Remember, you've got this.
You have the knowledge, the skills, and the passion.
Now go out there and rock those interviews.
I will. And to everyone listening, remember, never stop learning, never stop growing.
And never underestimate the power of communication.
It can truly change lives.
That's what makes this profession so special.
Yeah.
Thanks for joining us on this deep dive, everyone.
And see you next time.